All right, today we're going to dig into a really big question, something that comes from the work of Vicente Navarro. And it's this: what if everything we think we know about health policy, diet, doctors, all of it, is actually missing the point, like completely?
So let me just ask you straight up. When you hear the phrase health policy, what comes to mind? Seriously, what's the first thing that pops into your head?
Is it, doctors, hospitals, maybe that whole confusing maze of health insurance? Or is it something more personal, like your diet or exercise? Those day-to-day choices we all make, yeah? If any of that sounds familiar, you're definitely not alone.
Okay, but here's the twist. According to the author we're looking at today, focusing only on those things is a massive mistake. It's kind of like trying to solve a super complicated math problem by only looking at one number and just ignoring all the other parts that actually give you the answer. So first up, let's dive in and really break down that common view, which, as we're about to see, is actually a pretty narrow way of looking at what health is all about.
You see, for most people, and even for a lot of governments, health policy basically just means medical care policy. But the author, Navarro, he argues that this completely misses the biggest, most powerful forces that really shape how healthy we are as a society.
So what are these powerful forces then? Let's pull back the curtain and look at the invisible things that are actually running the show when it comes to our health.
This brings us to a really key idea the author introduces: structural determinants. Now, what's so wild about this is the definition. This isn't about the choices you make. No, this is about the big stuff, the political, economic, and social structures of our entire society. And get this, according to the source, these are the most important factors for our health, period.
Okay, so what does that actually mean in the real world? Well, it's things like, how much say do regular people have in politics? Is there real economic security, like policies that push for full employment? Is there a strong social safety net to catch you if you fall? Are there actual policies trying to shrink the gap between the rich and poor? And it even comes down to the culture. Are we all about solidarity, or is it just dog-eat-dog competition?
And this comparison here just shows you the real-world impact so clearly. The author puts the US and Sweden side by side. In the US, you've got these separate, issue-oriented movements and really low voter turnout. But in Sweden, you see this history of powerful, class-based labor movements and tons of people voting. And the result? It's not just a different political vibe. It leads to totally different health outcomes for everyone.
Which, of course, brings up a huge question, right? If all this big-picture structural stuff is what matters most, then why are we always hearing about lifestyle choices?
Well, the answer to that brings us to our next section, this laser focus we have on lifestyle. And as you'll see, it's a focus that's, pretty convenient for some.
So here's the bottom line, according to the author. Focusing on lifestyle is politically convenient. Why? Because it takes all the responsibility off of public institutions, like the government, and puts it all right onto your shoulders, onto the individual.
And we all know what these interventions look like, right? It's all the campaigns about eating your veggies, getting more exercise, quitting smoking. Now, don't get me wrong, that stuff is important. But according to the source, it's just one tiny piece of a way, way bigger puzzle.
So, how do we connect these two worlds? The huge structural stuff on one side and our individual actions on the other? Well, that leads us right to the third and maybe the most crucial piece of this, the power of empowerment.
So empowering determinants, that's the key term here. And they're all about building a bridge over that gap. These are the kinds of interventions that don't just say, hey, you, change your behavior. Instead, they empower people to team up, to join movements, and to actually change the systems that are making them sick to begin with.
And to make this idea really hit home, the author gives us a super powerful example, the Black Panthers, back in 1960s Baltimore.
So what was the action? They mobilized young, unemployed people to stand up together and challenge the oppressive conditions they were living under. And the result? It was an absolutely stunning public health victory. A huge drop in drug addiction, not just for the people involved, but for the entire community.
And there's another great case study that drives this point home: the coal miners who went on strike in Appalachia in the 1970s.
And what did they do? They didn't just sit around and complain one by one. Nope, they got organized. They went on strike together to protest the incredibly dangerous conditions they were working in. And the result of that collective fight? It wasn't just better health for them, it was better health for their entire community.
And this all leads to the author's really powerful takeaway, a direct quote: "Commitment and solidarity are good for your health."
It sounds so simple, right? But it's an incredibly profound idea that working together for each other has real, measurable, positive effects on our health.
Okay, so let's put all these pieces together. In our final section, we're going to lay out a whole new way to think about health based on this three-part framework from the author.
So here it is, the author's model in 3 simple steps. First, you have the foundation. You got to fix the big structural issues, the inequality, the powerlessness. Then second, you have support. That's where you bring in those lifestyle things like diet and exercise. And finally, step 3, the link that holds it all together. You use empowerment to connect what individuals do with what we can all do together.
But look, this model, it's not just some technical blueprint. It's really about a fundamental choice we have to make. The author argues that the whole point of this shouldn't be to just create better, healthier competitors in our society. The real goal should be something completely different. And that's the final, really thought-provoking question this all leaves us with. Should our goal for health policy be to just create a society of tougher competitors where everyone is just fighting for themselves? Or should the goal be to build a society that's actually based on solidarity? One where we make ourselves healthier by working to make everyone healthier?